in one of the most remote places on Earth, an outback mining town, hundreds of kilometres from the nearest capital city.
Couldn't imagine being anywhere else.
Broken Hill's emergency department
Do you have any beds available?
copes with the extraordinary.
Snake bites, mining injuries, farm accidents.
Its patients are those tough enough to call this harsh place home.
I was lucky, I lost the leg. I'm still here.
Each day brings the devastating lows.
And I fear one day that it might fit and that's the end.
You go home and you question, was there anything else I could have done?
And remarkable highs.
Thank you very much.
Every now and then you get to be a hero, save someone's life, and that's a really good feeling.
Thank you.
That can only come when you live in the middle of nowhere.
Copy 724, right, this is maintain 2000. Maintain 2000, 724.
Probably some of the most interesting people that I meet out here would be people that are, about to embark on their great outback odyssey. So we get a lot of people from Sydney, Melbourne, where Broken Hill is the last stop before the great Australian outback. And if they run into any problems out here, they'll often call in before they head out bush for weeks at a time.
The flying doctors are bringing in a traveller whose outback adventure has come to a sudden, horrifying end.
Bit of a bump, Yvonne.
68-year-old Yvonne was driving alone when she lost control, rolling her motorhome on a remote stretch of road about 200 kilometres east of Broken Hill.
So where's home for you?
In my van.
And okay.
I live in it.
Yep. Okay. Awesome. What about, was there some family? Where's family?
Well, my children and grandchildren are in Auckland, New Zealand.
Yep. Okay.
Yes, my husband died 10 months after our son was killed.
Oh, I'm very sorry to hear that, Yvonne. One, two, three. Well done. Well done. We're across now.
Okay, so just to recap, you were going at 90 kilometres an hour. Rolled a couple of times. Were you wearing your seatbelt?
Yes.
Good. Is your vehicle fitted with airbags? No. No, okay. And did you lose consciousness?
No, all I can remember is the rolling and the head hitting that, I think it was the door, and thinking, holy cows.
The main thing we have to do for you today is make sure that your brain and your spine are safe. She knocked her head, so it's important to make sure that she's neurologically intact, that her brain is safe, and she was complaining of some spinal tenderness. So we need to be careful to make sure that her spinal cord's safe and working as it should. We're going to roll you onto your side. What I want you to do is nothing, okay? Just let everyone roll you, don't help. Yep, relax.
No.
Sorry, sweet. Tenderness down here.
When I actually saw the photo of the van, I was shocked. I was like, oh my God, I don't know how she survived. I remember saying that to the guys at work. I said, my worst nightmare just came true, Mum's rolled her van.
Tenderness down here.
Yeah, tender.
Sore.
The reason why Mum has been travelling around Australia is she's originally from Australia. My oldest brother, Jeff, he was flying his plane and crashed. So he died, and then it was really hard on Mum and Dad. And then Dad passed away about a year later, just over a year later. And yeah, so she went, you know what, too much. When she first took off, she wouldn't stay in contact, and I had to tell her off because it was like, you know, Mum, we need to know where you are. We need to know what part of the country you're in. And if you're going out of contact, we need to know where you're going to from and how long do you expect to be out of contact for? Because this was my worst nightmare.
And she's tend to hear and sort of in a right upper quadrant, so I want to have a look at that. Think about her liver. Sure, yeah.
Okay, so
contrast, please, yeah.
Okay, no worries.
My biggest worry with Yvonne is that she could have a liver laceration. That means that there's a cut within her liver and she could be bleeding from that, which could lead to dire consequences.
I actually haven't seen anything like the landscape in Broken Hill prior to coming here. It's my first time in rural Australia, so it's been a bit of an experience for me. I was born and raised in the UK. I did all my medical training there. I worked there for 2 years. Then I worked in Sydney for 12 months prior to coming here on a rotation. When I first arrived in Broken Hill, it's mildly depressing, if I've got to be honest. It's a small town, but actually being here is different story, to be honest. It's not as bad as you'd think.
A place like Broken Hill isn't the most desirable location in Australia. We're 1,200 kilometres from Sydney, 550 kilometres from the coast. It's hot, it's dry. People don't want to come here. We obviously have to be pretty creative with our recruitment here in Broken Hill. We try and give them an experience that they can't get elsewhere. $10 each way on a sure favourite. It's got to be a Rainbow Bay. Smile, boy!
I've grown up in Sydney. I never thought that I would really, fall in love with Broken Hill, but I think that I definitely have. It's the difference in the people and the medicine that you see. It's just fantastic.
I first saw the place, to be honest, it was a breath of fresh air because it's this big town in the middle of nowhere, but it's great. It's, I fell in love with it as soon as I drove in. I thought, yeah, this is cool. I'm happy to be here.
Basically, I'm from Lebanon. For Broken Hill, it's like a mini city. You can find everything you want. The people here are lovely, more social. I'm not feel strange. Hi, Vince.
Hey, Ali.
How are you?
Good.
How are you going today?
I'm not too bad. Spent a bit of time under the cold water. But...
Okay, that's good. I have a patient, 63 years old. He came with agony because he poured hot water on his genitals. How did that happen?
All right, well, we were cooking the sausages, and we always do it in water rather than fry them, thank Christ. I was taking the skins off them, and as I did that, I tipped the pan,
What did you do after that?
I just went straight in the shower.
Okay, and then you came to the emergency. Would you mind if I examine you?
Not a problem.
Okay, thank you very much. Okay, so,
I was going to say, you don't have to warm your hands up, they're already hot. We boil the sausages because Sandy's always said, don't like them fried. So she likes them boiled. So we boil them, skin them. And I said, well, why don't you just buy skinless sausages? No, don't like skinless sausages.
When I hear about injury like that, I can feel the pain, the same pain with him. By itself, it's sensitive area, the genital area. And in addition to the burn, it will be really very painful. Would you mind if I have a small look? Okay, so actually I haven't seen here. It's painful, is it? Yeah. Okay.
Did it start to blister?
Yes. within our assessment, because we need to send to the burn unit to see what's going on there, they always ask for the picture. So I went to Vince and asked him, I told him, look, I have sad news, we need to take picture, including your genital area, to send to the burn unit. And then he said,
well, if you're going to take a photo of it, I would have liked to have an extension, because that cold water was on there for about 45 minutes. You see what a turtle does, don't you?
I don't think it's severe burn. So all we need to do is we'll give you some cream, we'll do some dressing, I'll give you some antibiotic. In Broken Hill, we rely on our clinical experience and physical examination more than we rely on the lab results and about the imaging, and give us a good experience that if I go to any hospital everywhere in the world, that I do very well.
When Ali's dressed it, I'll just go home and do nothing.
Yeah, I'd say that
which
too,
is quite normal, actually. We don't do much anyway.
I have a blank as to what happened until I started swerving. So, yeah, so I can't tell you physically what was the distraction on the road, but all I can visualise when I close my eyes at night is seeing me rolling in the van.
Lone traveller Yvonne is lucky to be alive after rolling her motorhome on a remote outback road. Doctors are worried she might be bleeding internally.
Over we go. Okay. I worry about her liver, that she's got a liver laceration. There's potential for that to be quite a problem. Okay, let's get you some pain relief.
Yes, please. For the last 2.5 years, I've done 48,000 kilometres around Australia. Absolutely beautiful, you know, the country is just absolutely beautiful. That's why I love it, because I'm seeing my country with all the beauty that it has.
It's in her blood. So, and now she said to me before, being out on the road, it gets into your blood, being out there, just living that lifestyle. I would love her to stop it, but I don't want her to stop it because we want her to stop. It's what she wants to do. I know that she's not finished travelling Australia.
Yvonne's CT and X-ray results have come back and they've all been quite normal. So the pain that she has over here on her right side isn't a result of a laceration to her liver, which was one of my biggest worries. It must just be soft tissue injury, which is good.
I should be far more hurt than I am. Jeffrey and Ian were definitely there, protecting me in the van as I was rolling. So, yeah, sorry. It's just getting a bit much. Yeah, just visualising. I wish my boys were here with me, alive, here with me, but they're not. But they're there to help. You know, they're there to help, so.
If she lets this stop her, I think it'll be one of those regrets. It's her life, you know, she's worked hard all her life and she deserves to, you know, be happy and make the best of it. Even though I'd love her to come back, I think for her, she needs to finish what she started because she'll regret it.
Chloe's been sick for about 3 days, nearly 4. She started to vomit and get really lethargic, wasn't keeping anything down. She didn't have any wet nappies and I was very worried about her.
9-month-old Chloe's been rushed to Broken Hill by the flying doctors after suffering an extended bout of gastro.
We live about 130 kilometres from town and I just thought, you know, because she's a little baby and babies go downhill very quickly, I just thought I'll ring the flying doctors and they made a decision to come and get her.
Don't drop the elephant.
Out this way, it's not as easy to access the medical care. So in Sydney, where I've worked before, you know, you're 5-10 minutes down the road and you're at one of the biggest paediatric hospitals in the country. But here, Chloe's an hour and a half away by car.
How many diarrhoea episodes?
Yesterday she had 11.
Okay, and what about the vomits today?
Today she's had 2, quite a big one this morning.
About how many vomits yesterday?
Lots and lots.
Okay, so is anyone else sick at home?
Dad came down with it last night.
So we're vomiting and diarrhoea?
Yeah.
So has she had watery diarrhea?
Yeah.
Any blood or mucus in the diarrhoea?
No.
Okay, any fevers at all?
No.
Not feel hot?
She feels hot.
Are there animals around?
Yeah, we've got animals.
And has she been like with them?
No.
No one. Okay. Have you been travelling anywhere recently?
No.
And when did these red checks pop up?
Probably since this morning. Like early.
So paediatrician Miriam was looking for the level of dehydration. She's also looking at the cause of the dehydration. So is it just basic diarrhoea, or is it diarrhoea because some sort of illness or some sort of virus that's causing that diarrhoea, and how serious that may be?
I think probably she's got a viral illness. The question is it gastroenteritis, or is it, you know, like in little babies it can be tricky to tell. Some viruses can actually give rise to the vomiting and the diarrhoea. And I would prefer to put a drip in so we can get some bloods, and we'll give her some fluids that way, and we'll do some blood cultures, and we'll get a urine specimen, and we'll just do it all.
Oh, I'm sorry. I know. All right. Nursing a baby like Chloe, yeah, reminds me why I wanted to be a nurse. I found paediatrics quite hard when I started kids, especially in the emergency department, because you're not only looking after the kid, but you're looking after the whole family.
You're doing a good job.
It's quite daunting because parents, it's their little world on that bed, and then you're trying to settle them down about that little world. Oh, darling. There we go. It's never an easy task to do cannulation on a child, especially a baby that age, and it's something you really need quite a few years' practice.
When did these pop up?
I noticed them yesterday.
So these are new?
Well, I noticed them yesterday, but with the eczema, like, stuff comes and goes. Do you know what I mean? Like, this sort of stuff.
But this isn't eczema, I don't think. So that's... Are these new?
Yes, they are new. That's new.
Keep an eye on this, really.
All right.
The spots could be the result of a bacteria called meningococcus.
She's not been immunised for meningococcus yet because it's at 12 months. We've got to think of meningococcus, we've got to think of these things.
If she does have the bacteria, it could lead to meningitis, which affects the brain and spinal cord. Many victims die within 48 hours.
A violent person came into the emergency room and he started spitting at the poor man behind the window, and he was yelling and screaming, and it just continued on to the point that they were out in the car park. They asked him to leave. And we were out in the car park and he broke my window. Like, he literally, just like being so aggravated, his body went against my car and it shattered my window. And all I kept thinking was, it's my 2.5-year-old, she's near glass. And I lost it. So I just jumped out and I pushed him and screamed, and then he hit me, and so I just hit back. And I obviously don't know how to punch very good because I broke my hand doing it. So, and that's how I got this.
It's less rare for a woman to come in with a broken hand from punching someone out here in Broken Hill than in inner city Sydney, where I've worked. But you see all sorts of fractures as a result of fights here.
I'm a full-time single mum. My oldest is 3.5. She's just been formally diagnosed with autism and she can't talk or communicate. And my 2-year-old, she's a diva, Amelia, and she's normal though, there's nothing wrong with her.
You can see she was really trying to do some damage when she did this to herself. So you can see the nice smooth lines of the bone here. They're all nice and regular, but over here you can see there's that break in the outside of the bone there.
I have bipolar and borderline schizophrenia. I have a problem with people judging me. People look at me and they just see a person that doesn't have it together. And I just don't understand society, the harshness, the cruelty, just the two-face, how someone can be nice to your face and be horrible behind your back. I don't understand any of it.
Darling, I've got some, I'm going to give you an injection, some ketorolac.
I don't like needles.
All right, it's going to help with the pain in your arm, okay? You don't even have to look at it, I'll just give it to you, all right? And I've got you some Panadol.
I'd rather the Panadol than the needle.
Well, you can have both, sweetie.
Do I have to have the needle?
You don't have to, but it's probably the best pain relief. All right? Okay. All right, it's coming now. Just relax for me.
Yep. Breathe, wiggle your toes, breathe, wiggle your toes, breathe, wiggle your toes. Wiggle the toes, wiggle the toes. Oh, golly gosh.
That'll go away in a minute.
Oh,
good girl.
Thank you. I've been with a psychologist at the mental health department since I was 12, but I have been medication-free with stress techniques and my psychologist for 3.5 years since I've had my kids. So it's hard, each day is a struggle, but I am completely medication-free. I think I'm doing really good.
It is more challenging in treating people with mental health problems. It's nice with things like fractures because you've got an objective finding on an X-ray and it's reasonably easy to assess. It's much more challenging with subjective things like abdominal pain, shortness of breath, chest pain to actually ascertain what's going on. Look, Tamara, so it looks like you do have a fracture on the X-ray. It's not a bad fracture. It's a fracture that we can just treat by putting a cast on it to support it. How did he pull up?
I broke his nose and his cheekbone in one punch. You know, my kid was in the back seat. It was just that whole adrenaline, it just kicks in, the thought of someone being near my child. And I don't regret it. I said it to everyone, and I'm usually the person that doesn't hurt a fly, and I'm so sorry if I, even like bump into someone as I'm walking next to them, but I seriously do not apologise for that. I think this break is well worth it. Not apologising.
For 3 days, 9-month-old Chloe has had severe vomiting and diarrhoea. After finding a sinister rash, doctors now fear she might have contracted meningitis.
I might even do a lumbar puncture.
A lumbar puncture is when they put a needle into the spine and they withdraw some of the fluid from your brain. You can test that fluid and show whether or not there's any infections in the brain. A lumbar puncture for a baby is a little bit risky. The risks can be quite serious if it's not done right.
Chloe's our second child. Her older sister's name's Emily. She's 2 years old and they love each other. I said to Emily this morning that we were going to have to bring Chloe in to see the doctor, and Emily straight away ran and got Chloe's teddy and packed her own bag so that she could come too. And I don't know if she understands, but she knows that Chloe's not feeling well.
The toughest cases for me are children. Children and babies, nothing's worse than that. It has more of an emotional toll because, they are young, they haven't finished living their life. They just were unlucky. It makes that emotional toll that little bit higher.
That's my husband. And that's my son. He went for a Sunday flight in his private two-seater Red Baron plane and crashed into the sea head first. He had dived into the very popular beach on a Sunday afternoon at 3:30. It happened, yeah. My beautiful boy. My beautiful, beautiful boy. Forever 44 years. Love him to bits.
She's had some hard knocks, which has made her hard, but she's also lovely, kind-hearted, will do anything.
It's been 3 days since Yvonne's terrifying accident. Now she's had the all clear and will leave hospital today.
I've got a big choice to make, whether do I still want to travel around?
Let's go. No wheelies.
Or do I want to cut my losses and say, no, go back home with my daughter? Thank you, staff. Thank you all. If I had my van, wouldn't be a decision, you know, I'd be just travelling around forever. But it's a big decision now. I'm an Australian, I'm not a Kiwi. I'm Australian, I'm a Queenslander, and you can take the girl out of the country, but not the country out of the girl. And this is my home.
Chloe is heaps better today.
Chloe's blood tests and observations overnight were good, and therefore we didn't have to do a lumbar puncture. The red spots made us concerned because they can be a sign of something more sinister, like meningococcal, but they can also be a result of her gastrobug, and just like a lot of other kids, she's bounced back.
A good relief that there's nothing more serious and, yeah, that we can go home.
Next time on Outback ER, the mystery disease that has the ER's finest baffled.
Why the shutdown? It doesn't make any sense.
A heartbroken daughter prepares to say goodbye.
Are you going to come back to us, or have you had enough?
We meet Broken Hill's real-life queen of the desert.
He goes, "You've got the biggest balls in the department." And I go, "No, sorry, boss, not anymore."
And the coat of arms collisions. What happens when bush-bashing bikes
doing about 80, and then an emu came running out.
hit Emu and Roo?
I hit the ground pretty hard. I got thrown a good 50 metres for my bike.